Let's start first. I'm going to be talking mainly about our numbers and our COVID cases, our community transmission, our daily positivity, and the vaccination numbers and rates. So with that, I'm going to start with this first slide showing the basically the United States showing once again we're seeing a rise in the COVID cases, hospitalizations, deaths. And as of July 22nd, when I took this from the CDC website, 35% of the U.S. counties were experiencing high levels of community transmission. The cases are on the rise in nearly 90% of the U.S. jurisdictions, and we're seeing outbreaks in part of the country that have low vaccination coverage. These are all worrisome trends because due in part to the rapid spread of the very transmissible Delta variant that we're seeing. I'm going to talk a little bit about it. And this increase in the number of cases will put more strain, especially on the healthcare system and our resources, and it will lead to more hospitalizations and deaths. So that is why it's so important to have my colleagues here from the hospital side to talk to you all specifically about it and how that affects all of us. So this shows you the level of community transmission. That means how much virus is in the community. Now, at the end of June, the whole country was in moderate. It had gone from high down to substantial and then very nicely into moderate. So all this was almost all yellow. There was just a little bit of red here and there along the states. And now it looks like this, and it's getting more red. So to give you a little closer look down into Florida, we see that all of Florida, with this is Glades County, it's all red. And this is what I showed to the Board of County Commissioners back in May in June, when I gave the last report. This is what we looked like. And actually Palm Beach County was actually in the yellow, in the moderate. And I was very hopeful, and I told the Board of County Commissioners that by July, if everything kept going this way, I was going to wait till the 14th of July because I was afraid we might have a peak. But hopefully, if everything went well, we could get Palm Beach County to actually turn blue to low. It's not politics. This is the colors they have for high, substantial, moderate, and low. Okay, so that's what we were hoping for, and we would have gotten there had we continued for a few more weeks. Unfortunately, after July, we peaked just like we did in 2020. So this is what we look like now. And part of this has to do with this variant. So this is what the variant, the proportion, the percentage of the variants that we have in the community in the United States. This is what it's looked like from the weeks from the 4/24 all the way to where we are now on this last week of the 14th. So right now, the dark orange is the Delta variant. That was this little tiny thing that showed up back on 4/24 that week, and it has slowly grown. But look at the exponential growth that happened between the end of June and these last 2 weeks. It just went up exponentially. And so now it's pretty much dwarfed everything else. We're at 82.2% for the variants in the United States. And this variant is 60% more infectious, which means that it spreads more quickly from person to person. This is not new. All viruses create variants. It's very usual because viruses are very effective infectious disease agents, and they adapt to the environment and they change in a way that makes it more transmissible. So the virus is trying to survive and continue to do the job it's supposed to do, which is spreading from person to person. And the way they measure this is the World Health Organization and the CDC. They've been monitoring these variants that they know are going to happen, and they keep us updated on what's going on. Right now, I want to emphasize that all the vaccines are working against these variants. The danger is that if this continues as the predominant variant, especially here in the United States, then we're in danger that the vaccine will not be able to work because it will continue to variate in a way that the vaccine won't protect us. So that is why it's so important. We're really at a pivotal point right now that we have to get our vaccinations up so that we can take care of bringing these numbers down. Give you another slide here and show you that this is the amount of doses that we're administrating. So this is what we're trying to do with the vaccine. Now, if you look at the terms of numbers of vaccine, Florida is doing really well. This is the darker blue. It means that there's more doses being administered. So for Florida, we have a lot of doses, like Texas, California, and up in the Northeast. But if you look at it as per 100 population, then we kind of fall into this, we're not as bad as Georgia and these southern states here, and we're better than Texas, but we're definitely not in the dark blues. Okay, so we're right here in the in this area here. So we need to do more to continue to vaccinate and get those rates up even higher. So what is it that we look like? These are our numbers for Palm Beach County, and I pulled these from the presentation that I did the other day. So these are from the 26th. On the 26th, we had 864 new cases. Our average daily for the week is 704. That's up by 251 cases since the 20th. So our numbers are expected to double every 10 to 14 days at this point. That's how fast this virus is spreading. The positivity for Palm Beach County, that was down to 3%. So it had been down below 5 since the beginning of May all the way through June. It is now 15.96. All right, and for the state, it's 16.73. So we're lower than the state, but that should not give you any comfort. We're way too high, okay? Now, in terms of the vaccinations, the state is very happy to be for the percent of people 12 and older. They have vaccinated 60%. This number is inflated, okay, because of all the people who are elderly who have very high vaccination rates. Palm Beach County, the number for 12 and over vaccinated, that means they've received at least one dose, is 64%. All right, so what we want, the number that we really want, is the people who are have received both doses, and that for each age. So if you look at that here, this is for the cases. You see, and I don't know if that's big enough, perhaps you can't see it, there's too small. When you look at the 12 to 19, they're only at 35%. So even though all the ages, the Florida can claim to be at 60% of 12 and older vaccinated, the younger age groups, the group that's going to the hospital, is at best up to 47%. Okay, you don't start getting into the 60s and 70s until you're after 75 for 60 and through 64, and 65 and over are at 84%. So this number overinflates this very low number for an average then of 60%. So we have a long way to go before we're going to be safe and not seeing cases going to the hospital. This shows this is the number of vaccinations that we've done cumulative, these dark bars. So you can see we started out real slow back in December. When we got it towards the end of December, we were having shortages here. People were crazy calling the phone lines, couldn't get through. Everybody was hitting each other over the head with trying to get in line. And then as the supply started coming, we continued to go up, and we've continued to vaccinate. But the heavy vaccination occurred here with this graph that shows you the weekly case counts of vaccinations. And then it dropped. It went back up when we started lowering the age. We dropped to 50, 40, 30, and then we hit all the way down to 12. And then once again, supply and demand, as we got the supply out, it went low. Now, the one glimpse of optimism that we have here is that for the last few weeks, that has started to go climb back up. So that is very hopeful that as we're getting this message out and people are seeing that new cases are coming, that we're able to convince people that the one thing that we can all do to cut this back down and get back to normal and to get back to feeling good, being able to go out and go to restaurants and see your friends and travel and everything, is we all have to get vaccinated. That's the only solution. Okay. So, what are we doing in the health department? We're continue to serve. We have public vaccinations going on for the public in Belle Glade to make sure our underserved communities are being served out in that area. So is the FQHC in Pahokee. We're doing vaccinations as well as testing with both the PCR and the rapid testing. Now, I am telling you that some people are avoiding getting vaccinated by going every week to get tested. So we've been trying to reach out to those people who are getting vaccinated routinely and say, why are you doing this? And they say, well, we're afraid of getting COVID. I said, well, then why don't you get vaccinated? So we're trying to speak to these people when we see these routine testers that are coming through. The answer is to get vaccinated, not to keep getting tested. We're also doing a lot of community vaccinations, and we have our website set up for anybody that wants us to come out to them. We're trying to go into the areas, the zip codes, and the census tracts that have the most cases, and the areas where we have less vaccination rates, and we have certain corridors still that have, about 50% vaccination rates, and that's what and it's been very effective. We're seeing those areas increase with vaccination, getting more to the 60 and the 70% vaccination rates that we want. So the mobile units are both being done by the health department as well as with the healthcare district, and we're giving $10 food certificates to go as a bonus for getting vaccinated. We're also implementing very shortly, we'll have it in place, a plan to do monoclonal therapy for the people that qualify for it, who are positive, before they start getting sick, when they're still well, and that will help alleviate some of the therapy that's being done in the ER, which is tying up beds, and that will help get that flow of the ER going through a little bit better, so those beds aren't being done. This should be done at home or in therapy locations that are some available here in the county. We're also working with the county on a vaccination campaign. There are buses that are being wrapped right now as we speak. We're sharing our calendars with one another and making sure they're working and we're not overlapping or going to the same places or being at the same time or same areas at the same time with the healthcare district mobile vans that are going out. The healthcare district is concentrating a lot on getting the kids vaccinated, 12 years and older. And we have seen a 3% increase in those ages from 12 to 19. Both of those have increased a whole percent in the last week. Each week we've seen it increase by 1%. So that's a very positive direction that we're going. And then finally, with this vaccination campaign, we're also sharing our calendars. We're putting on videos, testimonies from people who were waiting and waiting and then all of a sudden caught it and have regrets because now they're on inhalers. They are having problems with their kidneys, the liver, their heart, and especially their lungs. Vaccines are free, and so is testing. There are two sites that are very important that you might want to write down. The first one is where to get your free vaccine. You can go to www.vaccines.gov, and you put in your zip code. You can put in within a 25-mile radius or however far you want to drive, and it will tell you what pharmacies have the vaccine available and whether or not they're in stock. You can pick a specific vaccine, or you can just pick to see which ones they have. The other one is www.hhs.gov. Again, same kind of idea, and what that does is it gives you the sites where the testing is free. It should all be free. The places that are charging, sometimes they tell you, oh, the test is free, but you got to pay for the results. Or they'll tell you, they're going to charge your insurance. Your insurance should not be costing you anything. But please don't take advantage. They are supposed to be free, and there are lots of places. Those places that I listed on there: CVS, Walgreens, Walmart, Sam's Clubs, those all do free vaccinations, and CVS, Walgreens, and Walmart are also testing. I imagine that as more people test, they might get backed up. And so we're talking with the county to see if we can set up maybe a vendor that will come in and do testing for more people so that the testing can continue. And in closing, I just want to reiterate, as I always have, that we need everyone's help. Palm Beach County has been phenomenal in following us and doing the best that we can in terms of using your masks and helping one another to get out and get vaccinated. But that's the main stress right now, has to be get people who are on the fence, off the fence, and over to get their shots in their arms. You got to do it for yourself, your family, your friends, and most importantly, our community needs you to do it, because we need to get back to a lower positivity so we don't have to be in this mode that's going to cause everything that we went through in the winter. This has an escalating effect, which will affect people's jobs. Jobs will close, people won't go out, they won't shop, they won't go to restaurants. That hits the economy, and it's this vicious circle that we keep getting. We've done this now for the fourth time. We have to get back to some kind of normal, and the only way we can do that is by vaccinating.